I'd like to call this meeting to order for Tuesday, July 8th for Health and Human Services. Roll call, please.
Kay Wilson.
Here.
Tweed Schuman.
Here.
Marshall Savitsky.
Here.
Chuck Van Etten. Jeff Haney. Bill Trepanier. Dawn Pettit.
Here.
Carol Pearson.
Here.
Dr. Dunlap. You have a quorum.
Thank you. And now we'll pledge allegiance. The flag. I pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And do we have certification of compliance with the open meeting law?
This meeting was noticed to the news media and the public as required by section 19.84 of the Wisconsin statutes.
Thank you. Our agenda is set. Let's consider approval of the minutes from June 10th.
I'll make that motion.
Motion's been made and seconded. Any discussion? All in favor?
Aye.
Opposed? Motion carries. So now we have a budget for public hearing for our budget. So I'll entertain a motion to go into public hearing.
So second.
Motion's been made and seconded to go into public hearing. All in favor?
Aye.
Opposed? So carried. So Julia, you have a presentation for us?
Yes, so I'm going to replace the current share here. And get to the slideshow. Come. Okay. This is going to be similar to what I did present last year, just walking through some things. We've had a lot of things up in the air as far as what budgets are going to look like federally and state. So I have a little bit of input, being that the state budget was passed on July 1st, and then by the 4th, I think he cited on the 4th. For the federal budget. So we'll have a little bit more information as those got published, and yesterday a lot of information was coming out on those. But we'll kind of look through. Today is really kind of going through the services that we have. We don't have budget numbers exactly in for 26, but we'll have that finalized. So next month will be our final where we're making the decision on the budget. So just wanted to kind of go over some of the services, the funding overview, how we're funded, and the services that were offered. Things that drive our services are mandated by statute. We use the county health assessment, public input. We have internal input through care team meetings and outcomes data, community input from public stakeholders, and then funding availability. And then funding sources, we look at basic county allocation. That is something that is allocated to us from the state, and then there's additional state aids. Actually, basic county allocation can also come in federally. We have grants that we look at. We have contracts that we provide services for. And then we have a fee schedule. So some things are private pay, insurance. We do have the WMCR, which is the Medicaid, Wisconsin Medicaid cost sharing program. And we have county levy, and there is maintenance of effort in some programs. So last year we talked about WMCR. I'll go over it just really briefly, but it's basically when we have services that are Medicaid fee-for-service programs, there's a cost settlement component that the state and the feds give us to help support those programs. And so DHS really keeps 17% of the federal share for each positive settlement. And that excludes comprehensive community supports and community recovery services. So as I go through these are all the programs. The ones in green are the ones that we actually offer. So community support program, that's the program that we talk about that we get through, we work through Northland Counseling. CCS, we have internally, that's 100% funded. Crisis intervention stabilization is provided through Northland. We have outpatient mental substance abuse services where we would do counseling in-house, and targeted case management is typically, well, basically has been through Birth to 3, but now we're starting to be able to bill some of our other services to be able to create income. So as we have those targeted case management dollars, not only do we get those dollars that come in, but we get the WIMCR on the back end. We just don't really know exactly what that will look like.
Julia,
Oh, yes?
it's Dawn.
Oh, hey, Dawn.
Zoom can't see the screen share.
Oh,
So you're sharing, but maybe, what are you seeing? The
Just the participants and the room.
okay,
oh,
let me stop sharing my screen and then see if.
Sorry for interrupting.
no, thank you. I thought we were sharing because it came up on the screen
Yeah,
here.
she's here. Okay, now can you see?
Oh, wait, I'm gonna put it back up again. Is it coming up now? Oh, is it coming up now?
Do you see it now?
Caitlin or Cole, can you see it?
Yes, I can see it.
Dawn, can you see the screen now?
No, it must be in my settings, so let me work on my end.
Okay,
Thanks. Sorry, Julia.
no problem. So just to give you an idea of what we received in 2024 for services that were in 2023, that's the only problem is it's a delayed response in what we get back. But for the community support program, we received back $230,000 for services in 23 and $65,000 in services in 22. So it really depends on what type of services, how we're billing out, and it's hard to anticipate what we're going to receive back. So just to kind of this gives you an idea of how WIMCR works. So for CCS, we received 92,000 back. Crisis intervention and crisis stabilization, we've gotten zero back because we've been covered through Medicaid. Outpatient services, we received about 14,000 back. Targeted case management, about 13,000. So that's part of what we get. It kind of just helps understand where money can come from when we're doing our work. Typically, we have not had that in our. Oh, now I'm gonna get stuck in our budgeting process. It ends up being something that really kind of helps makes us whole at the end of the year because we get it in about mid-December.
Chairman, Julia, are some of these programs sustainable? Meaning that I know when we started with CCS, we thought they were gonna bring in enough money because those are Medicaid patients to support the staff and everything we do in there.
Yeah, it does support the staff that are allotted to those services. So it is 100% funded with that. So that's sustainable. Whether we have a lot of clients or not, it does support what we have because it is 100%. ADRC. Just thinking about the services that we have there, those are mandated programs. We are part of the ADRC of the North, so we offer information and assistance, options counseling, eligibility screening, enrollment counseling. We have disability benefit specialists, elder benefit specialists, dementia care, SSI, and residency reviews. In APS, which is also mandated, we do elder abuse and adults at risk investigation, prosecution, education, and short-term case management. Protective services, we have guardianship work that we're doing, protective placement work, and interdisciplinary team meetings. In this program, we have our supervisor, Carol Martin, at 50%. We have INA specialists, Linda and Heather, are full-time. And Joni is part-time. And she's also we have dementia care specialist, and that's just 50%. Adult protective services, we have Rebecca Erickson as full-time. Carol supports about 50%. It kind of goes into some long-term care. Disability benefit services is provided through the ADRC function. We share that with Price County. Price County actually hires that person. We used to have disability benefits, that position here. But when Hank changed positions, Price County was willing to pick that up. So they maintain that. And so when you look at where we've been at with budgeting and revenue, I'll have to read up here. You can see where we were at actual for 2024, what we budgeted for 2025, and we're pretty on check as we move through. So might even have a little bit more in revenue collection than what we had previously anticipated. Behavioral health services. We have we have an information and referral center, which we must have. 24/7 crisis intervention services. We have behavioral and AODA services, mobile crisis and stabilization, community comprehensive service or comprehensive community services, CCS. We do behavioral health placements, so those tend to be our bigger dollar amounts that we are spending in these programs. CSP, which is our high mental health cases. We have the transitions CBRF. We have OWI assessments, CLTS, which really isn't technically under behavioral health, but is a program that's mandated and 100% funded, and CST services. So we can see where CCS and CLTS are the fully funded programs. Programs in green are programs that are not 100% mandated for us, but they help us reduce costs on the end of when we think about out-of-home placements, mental health commitments, and those types of things. The services that we have, Alicia is our supervisor, and those are the areas that she supervises. We still have the opening for the mental health AODA therapist. We have a CCS facilitator and OWI assessor, which is Haley. And at this time, Haley is also doing CLTS. So she's filling that vacant position. So she's staying very busy. And CST coordinator with Allison. And then the other things that are funded by our program would be Northland Community Services, with Caitlin being the director, and that they provide mobile crisis services, community support program, and transitions. And then we are consulting with Duffy's office, where Joe Bodo is contracted for services for Chapter 51 consultation. So when we have people that are needing to have commitment, he and Caitlin tag team to help manage those commitments, make sure that we have all our paperwork in place. We have our court hearings all set and ready to go, and trying to make sure we get people out of the hospital as soon as possible and into a placement. Most of the time, people don't discharge directly from a hospital. There is step down along the way. So looking at the area of revenue totals, looking at we had 711 revenue in 2024. We're estimating $1 million this year. We have 789 so far. And expense totals. And some of the expense totals they also include, because we're kind of a pass-through on the CLTS waiver program. So meaning when we buy supplies and do home improvements and things, the money comes, we kind of put it out, the money comes in, and we kind of we're passed through basically for that, but it ends up showing up in here. Okay, questions so far? Otherwise, we'll keep on moving along. Okay. Youth justice, we need to do intake, assessment, court-ordered supervision, case management, out-of-home placement. In the end of 23 and in 24, we identified the need of youth diversion and truancy, and thinking about vaping, drugs, and alcohol when we're thinking about diversion. So a new part of our programming is that youth diversion and truancy. We applied for grants to be able to get us started with that. So these programs are 100% funded through grants. And we're looking at where those grants are, is that going to continue or not? So far, we haven't heard any discontinuation in this area on the grants. Most other things that have been discontinued have already come through to us. So it's looking promising that we'll be able to keep going with the same access to these programs. In Child Protective Services, again, mandated intake and investigation, case management, court-ordered supervision, foster care kinship, and guardianship. And the identified needs that we had over this last year with this program is that our Child Advocacy Center closed in the fall of 2024 because there was no more funding, so they closed the one in Hayward. That meant that we didn't have any forensic interviewers in our area, no facility where we have the proper equipment to do the interviews, and no multidisciplinary team. HHS and Sawyer County Sheriff's Office have sent people to be trained in forensic interviewing. So takes a big chunk of time and a lot of learning. So that's pulled away from areas as well. Our YJ supervisor is working with LCOPD to utilize their interviewing equipment because that's been sitting where it's not really been used. So they're working on we've used some grant funds that we received to help get the room so it's child-friendly, because it was just, I don't know, Tweet, if you had ever been in that room, but it's just a cement box, basically. And so we're trying to make it a little more child-friendly for them. So I think it's looking good. I know there was a little bit of trouble with some of the equipment, but that seems to be getting better. And then our next steps is to add a multidisciplinary team. So trying to figure out what we can do with grant funding and other areas to help support those programs instead of adding to our budget expenses as we move along. So in this program, we have a YJ supervisor of Sarah. We have two youth justice workers that are full-time, and one position is vacant, and that we will be hiring for soon. We've hired our youth diversion and truancy worker. We have a half-time supervisor for CPS and 3 full-time caseworkers and a family facilitator. And CPS budget, as we move through, our revenue totals are coming in, and YJ budget is what really got kind of crazy over the last couple of years with expenses. So we're really kind of watching that. We're in the process of, and we'll have that finalized for the final budget, of really kind of looking at some of these kids and knowing, are we anticipating them coming out of the program? Are we anticipating another year of needing to be an out-of-home placement? And so far this year, we've been pretty lucky at not having a lot of new kids coming directly into YJ through referrals there. So it's been kind of maintaining those kids. Still have a lot of kids in the program, but at least we haven't been adding a lot of new kids along the way. Okay, did I lose a page? I lost just my transition screen. So economic support services. So we're part of Northern Income Maintenance. So we have food share, medical assistance, energy assistance, childcare, and the Wisconsin Home Energy Assistance Program. Our supervisor for this is Shauna. She does also does the coordination for the WEEP and the resolution coordinator. So basically, she does fraud investigations for the consortium. We have 3 full-time economic support specialists, and Kim, and then when it comes to additional economic support specialists, they're also working in the WEEP program. So this is one of the programs as well that will have the MOE, which will clearly spell out what you'll see. So that's the maintenance of effort. That means that we always have to pay a specific amount of money out of county levy every year. That cannot just be covered by what we're getting from the state and feds to help support those programs. I'll talk a little bit more about some of the other concerns that we might have on the federal side and where we'll be going. Public health services, we usually have in there our foundational areas. These are areas that we're required to work in. So communicable disease, chronic disease, environmental health, maternal child health, and access and linkage to care. And then kind of the capabilities are the things we do to get that work done. So some of the programs that we have are our communicable disease, which includes surveillance and investigation, STD, STI testing, animal testing for rabies. We have mass clinics and public awareness. Chronic disease and prevention, we've got health promotion events. There's child death review. We have overdose death review. We work with the Medical Sharps Disposal, Narcan, Peer Recovery, Healthier Together website. Environmental health, we have the agent of the state, the drinking water lab. We have radon testing available, lead assessments, food and water investigations, and health hazard investigations. And with maternal child health, we have WIC, birth to 3, school health, reproductive health, lead screening, newborn calls, sexual assault response team. We do access and linkage to care, which I've got up there, emergency preparedness and response. We have an emergency reserve corps who has been very active this year and out in the community. We work on social media and events. We do planning and training. We're part of the LEPC, and we do supply requisition. And then we're also responsible for having a community health assessment and a plan. In this program, we have Julie as full-time supervisor and health officer. We have 2 full-time public health nurses. In our Birth to 3 program, we have Lisa as the coordinator and Jen as the service coordinator. The other thing I didn't put in here is we do contract for services for all of our speech and language and occupational therapy and PT. So that's how we get those services. All those people are employed, all of them are employed by the school district, and then they work for us on their off hours. And then we have Kathy Becker and WIC. We have our sanitarians, 2 full-time sanitarians. We have environmental technician and water lab lead with Matt. We just hired Dustin Brockway as a limited term employee to help support the new ordinance that's in place. Just everybody is working on it. He's just helping to help with all of the workload. We have Joyce and Mary Johansson as public health specialists. We're really unsure where AmeriCorps is going. We did get our peer recovery back online with AmeriCorps, so they were taken off. There's and I can't even explain how that worked, but anyways, there's a back end way that we were part of the lawsuit that then allowed us to get back into, as a state, we were part of the lawsuit that allowed us to get back AmeriCorps. And it is looking like it's going to go into next year based on the contract that we received. However, we haven't heard anything about the other type of AmeriCorps programs that we're using. But that allowed us, I mean, we've had, we've had 3 years of having at least 1.5 FTE through an AmeriCorps program. So that was a lot of work that got done that we just are not going to be able to replace in the budget. So, and we only paid $5,000 a year for those staff. Just another cap on where we're at with the budget. And agent of the state program, one thing to consider with this program is this one needs to be budget neutral, so we need to make sure that our fees are covering those services. And then the other pieces that we have to support all of HHS would be our reception desks, records management, motor vehicle fleet, contract management, fiscal services, when you think of grant writing, billing services, tracking, and then oversight programs such as HIPAA, civil rights, staff training. So as you know, I'm the director full-time. Carrie Mann is our deputy director. Our admin assistants are Kathy Garby, which she does youth, children, and family. And we have Kelly and Emily who are here at the courthouse, and Melanie who is at the ADRC building. And we have 3 fiscal services people. And this is the wrap up of where we ended up in 2024. And kind of where we're headed in 2025. So again, our revenue comes from state aids and grants. We have general property taxes. We get collections from Medicaid and client collections. I never remember what the donations to org from HHS thing is, but Mike always, it's the one nice thing is we have our fiscal person right here ready to be able to tell us where that is.
That's the indirect cost from the county.
Okay.
It's a flow through, like you mentioned
Oh,
earlier, where it flows through as an expense, but we give the money to HHS to pay for it.
So there, I have to write that one down because I never remember what that one means. So that's the bulk of what I wanted to share tonight. In addition, just some of the updates of how we are, where we're at, and where we're looking at moving to. So now that we're doing just that final analysis right now on our fee structure schedule for the agent program to make sure that our costs are covering our expenses. There's going to be a change in how tourist rooming houses and some in resorts are set up within the model of the agent program with the state, which is going to change how our fee structure looks and will impact what we're doing with our program here. So right now, you can have up to 4 licenses if the properties are connected with those tourist rooming houses. So if they're right next door to another, you can get 4 licenses, but you only pay 1 fee. So we're doing additional work, but they only have to pay 1 fee. And it's just how it's set up right now. I know, and I see Tweet going, and it frustrates me because I know it's a lot of work. But what will be happening is they're going to readjust it and they're going to say, okay, if you fall into this category of 1 to 4, you're going to pay this much, or 1 to 3, I don't know. And then they're going to have another level where if you fall into 5 to 9, I don't know if I'm even close on my numbers, but then your fee will be this. So when we get into some of those bigger ones where they're resorts, they're going to be structured a little bit differently. So we're just doing the analysis on that because we do expect that to go through from the state for the next year, which will impact what things look like on our licensing side. So just trying to work through that as quickly as possible. Yes.
So Julia, the state is making that decision?
The state is changing, the state is changing how all of those will be looked at and what their licensing structure will look like. We have the contract for the state, so we have to follow that piece. What we'll end up probably doing is, because we do have our own fee for our new ordinance, we'll just follow kind of the structure. So everybody so that if you're in the 1 to 4 category, you're going to have a 1 to 4 category matching license in Sawyer County. So they're kind of 1 for 1 along the way. So just trying to do that analysis to make sure we get that. The other analysis is really looking at, actually, Joe and I were talking about what's a good way to be able to look at like our out of home or our commitment costs. So maybe looking more at bed days in Winnebago versus like, we've kind of looked at, oh, we have this many clients or we've been spending that much. If we can do an analysis on bed days over the years and kind of go, okay, we're anticipating this many bed days, that will be helpful for us. So looking at that, like I had said already, Sarah has already been looking at who's in our system on our youth. We're also looking at our youth that will be coming into adulthood. We have a few that are 16, 17, and once they hit 18, what does that look like? Where do they fit into adult? Are they going to end up being something that's landing on the county, or can we get them into other programming? So kind of trying to make those anticipations, because those are knowns for us, or pretty well knowns, to be able to look at as we move forward. One of the things that I wanted to talk about that happened with the state budget was I'm going to forget how this went through, but what the proposed was in the budget was that juvenile corrections day rate was going to change from $1,268 a day to $2,500 a day. If we had one person for a full year in Lincoln Hills, it would cost over $1 million to the county. This was going to bankrupt counties. So what we did was a lot of letters went out. I sent a letter out to our legislators, talking to them about that. And what ended up happening was the governor actually used his partial veto power on this. So what is happening is that with the veto power, the rate is actually will be reduced to $501. And I don't know how they come up with the costs or why this is, but it has something to do with the partial veto power. So it'll be a $500 a day in 26, so fiscal year 26, and $758 a day in state fiscal year 27. So that is actually going to save us money because we have kids in Lincoln Hills that we've been paying $1,200 a day on. So I was getting real nervous trying to watch this to see what would happen. So that's one of the things. We didn't get a lot of the other things that were asked to be included, like an increase for youth aids, so that we would get more funding in to help cover our costs. But that's a big one. That was a big win for us because I don't know how we would manage a $2,500 day when we have one person that's costing close to that a day in adult. We can't continue that anywhere else. The other thing I wanted to talk about with the state budget is it got passed extremely fast. They passed the budget and then they passed the budget. Within 24 hours, the governor used his veto pen on it and signed the budget in. That never happens that fast. And the reason that happened that fast is because there was an opportunity to do am I going to find it on here? There's a Medicaid assessment that we're able to get into. And there's a few states that do this Medicaid assessment on the hospitals. I'm not going to be able to find it. Here it is. Increase hospital assessment by 1.8 million annually, which allows for $2 billion of higher Medicaid reimbursements to hospitals, and it'll save 298 million GPR annually. So what happened was in the federal budget with this particular hospital assessment, they put a freeze on it. And on anybody who had their certain number where it's at, you get grandfathered in. So we went to the max and we got grandfathered in as a state on that. And so that we could be drawing back the most federally as we can. If that budget did not get signed before the federal budget got signed, then we would have lost that ability to get grandfathered into that. So that's why it happened so quickly and why the legislatures moved fast. was so that we could at least keep some of those Medicaid dollars coming in. So it's a lot of, I've been a lot more involved in the budget this year, at least on the state and federal, kind of looking at things than I ever had before, and trying to understand where things are at. So I think the only other big thing that we're really going to have to look at is the food share program or the SNAP program. I'm not really sure what the implications are on that, but there will be some cost sharing that'll be happening. I know in the state budget, they did include additional dollars to the programs to help us with the administrative work that we're going to need to be doing when we're looking at the additional assessments that have to happen and the job where they're needing to be looking for jobs. That's going to take a lot of more administrative burden on our team. So trying to figure out how we're going to manage that. So those are the things that we'll be looking at as we come down the road. We can open it up for comments, but I don't see anybody on the line or anybody here, so I don't know that we need to, what else we need to do.
What? We are in public hearing.
Mhm.
So the big news that's been about the big beautiful bill
Mhm.
is the cut in Medicaid. So did Governor Evers and their bill and their budget, did that protect Wisconsin Medicaid?
It helps protect some of the funding. Some of the Medicaid cuts that are going to happen are going to be happening over time and are slightly postponed. And I think where they were going to, and some of the things that where they thought they would see some of the most impact would be to the rural hospitals. So the other thing that went into the big beautiful bill is $50 billion for rural health transformation program, which is to help the rural hospitals stay functional and not close down because of lost revenue. So we're all gonna kind of have to watch this as it comes. Some things are very clear where we know things are coming and some things are not. There are some public health cuts that are happening. We know preparedness dollars are getting cut, some immunization, but frankly, you're not talking about a lot of money. We receive $7,500 a year for immunization, and now we're going to get $3,500 a year. I mean, in the scheme of things, that's not the huge impact. It's really some of these bigger ones where like the SNAP cost share rates and the administrative fees, those add up and become much bigger dollars. So we'll all be trying to understand what this means for counties as we move forward. I've been listening to that. We're part of the National Association of Counties. We have the Wisconsin Counties Association. So I'm on there on most Mondays. We have WICSA, which is our Wisconsin Human Services Association, Counties Association. And we have WALDAP, which is the Public Health Association. And then they help to be able to advocate with not only, oh my gosh, not only in the state, but also federally as we move forward. Other things with the budget. Yeah, it's, I know it's a little overwhelming.
It's amazing the services that you do provide.
Yes, we're going to try to continue to be able to do that. Again, we do braiding and blending as much as possible, so we'll continue to do that. I know as part of CJCC and one of our big asks, which we'll talk about tomorrow, is we really need a grant writer with the county that can help supplement some of these programs. We're doing the best we can. Mr. Schuman.
What about employee wages and retention of employees? Are we good in that aspect as far as the wage study we've done a few years ago?
We haven't had a wage study for quite a while. I think we've been, and I'm not sure quite how HR figures out, and maybe Mike, I don't know if you've been part of that. I know what everybody could always get paid more. I think our biggest struggle right now is we can't pay a mental health therapist what they can get paid out in the community. There's just no way. So, they can make $140 an hour. So there's no way we're going to be able to compete with that. So it's like, and that's obviously they have other expenses and things to be able to reduce that, but we're not going to come close to that type of a wage. We're not able to support some of the educational things that if you're part of a clinic, they tend to have, $3,000 in education dollars that you can get to keep your CEUs and those types of things. So compared to other counties, I think we've been trying to raise that up. I'm leaning to you now.
That last study obviously was before I was here. I don't know if we'll do a formal one like that again. Some counties are gathering data on their salary schedules and we'll be sharing that out, when that gets prepared. We were just asked for ours, I think earlier this week or late last week. So once that all gets put together, it will be shared out to all the counties that participated, and that will help us see where we're at compared to other counties at least.
Mhm. I think one of the things we just have to consider is really on our lower end jobs, when you look at like the minimum to make ends meet, you need to be making, was it 1940, did we say, or 1950 an hour? To be able to actually, just because of where we live and the cost of living, I mean, that's like the minimum that a person could live on and actually meet their basic needs. So those are things to consider. Any other thing for the hearing or fiscal discussion? Next month, we will be bringing the full budget in for the proposal. Obviously, we won't go through all of this. We'll do another public hearing to see if anybody has inputs now that we've got some of this published out. And there may be some comments then, but that'll end that.
I'll second it.
Motion's been made and seconded to open the public hearing. All in favor?
It's time.
Opposed? Carried. Now we're in public comments. There's no one online? All right. So, LCO.
Yeah, I can say something real quick. Lac-Courte Tribe recently held their tribal elections and there were 4 seats up. For re-election, 3 of those seats turned over, so the full tribal governing board now of 7 is set in place. And I think a few of those we should approach for being our liaison in this committee.
Well, Julia had a comment earlier when we were back and forth on.
Yeah, well, Bill did recommend that maybe somebody else be appointed for that. So we wanted to kind of lean into the tribal governing board on who you thought would be the best. But I know Lorraine's back and
Right.
she was very much
Yeah.
here and gave excellent
That's what I
report.
was gonna say.
Yeah, so I don't know if she's interested or what your thoughts would be for the tribal governing board, but we will let Bill kind of give us. I'm hoping he's taking that back and making that decision, so.
So where are we at with that? Bill, does he officially need to resign?
Yes.
You gotta, you could turn, yeah.
He had sent an email to Liz, and actually he has to send something to you and I to actually resign.
Okay, so Liz, are you going to let him know to do that?
Or did you reply back to tell
I
me
did
that?
not, because I didn't want to get a boss.
Yeah.
I sent it to.
I'll
you.
clarify that with him and make sure he does.
Okay.
Mark reached out to him first, talked to him on the phone. I just didn't want to get a whole loop
Yeah,
going,
get it.
but I can do something
convoluted.
official if that's weird.
Mhm.
In your resource center? Anything? Okay. Administration, do you have an update?
I think my big update was fiscally, and you heard it all already.
All right. Aging and Disability Resource Center?
Carol's here to present tonight for us. We
Yay.
haven't seen her in a while.
Hey guys, good to see you. It's been a while. So my name is Carol Martin and I am the supervisor for the Adult Long-Term Care Unit for Sawyer County. And we include Adult Protective Services as well as the Aging and Disability Resource Center of the North Sawyer County branch. So we are a small but mighty unit of 6 people and we've been in a bit of flux in the last few months. I knew that when I came to be supervisor that we have a lot of people in our unit who are getting older and who are thinking about retirement and moving on with their lives. And 2 people did do that in the last few months. Rose Elliott decided to move from her Adult Protective Services lead APS position, which I'm very sorry about that, and I'm going to miss her terribly. I do miss her terribly. She said something about farming and goats or something. So she's off on her farm doing wonderful things, her husband says. And then also, and we were able to replace that position. We have a person named Rebecca Erickson in. She started in May. So for a while there, I was one full-time APS and then myself in 2 different positions. And so it's been a lot of juggling, a lot of training. And we're not through it all yet, but Rebecca is doing an incredible job. She's really getting out there. She's making impacts in the community. And I think she's really making a positive difference PR-wise because when you hear the words Adult Protective Services, it sounds a little scary. And she and I are not as scary as people think we are. And then in addition, the other person on our team, so a third of our team basically turned over in the past 3 months. And they're kind of their own divisions too. So the other person was our elder benefits specialist, Hank Naris. Hank started 3 months before me, so I'm at 9 years now. And Hank retired. He was the benefits specialist for 7 years and the elder benefits specialist for 2 years when I moved up. We also were able to replace Hank most recently with somebody within Sawyer County Health and Human Services. So Shannon Ewert, who also used to be probate, if you guys know her from probate. She is now our elder benefits specialist and she has started training in. So again, I am myself in 2 positions. I am APS trainer and right now I am elder benefits specialist and trainer. So I apologize I don't have solid numbers for you this time, but the unit has been working hard. We've been reaching out to people and people seem pleased with our service. Our dementia care specialist is just out there and gung-ho. She's so passionate about dementia care. She's still doing the memory screen, so if anybody wants a memory screen, that's Fridays at the library. But she can also do something more personal so that you don't have to be seen anywhere to do it. And she would also love to train every single person in this room in dementia friendly. So I'm hoping to bring her along next month just to say hi and introduce her program a little bit more. She's also been working with LCO on a program that is called Wine, Women, and Dementia. And it's a movie that's going to be shown with mocktails being provided. And that's going to be at the LCO University. And that's July 31st from 2:30 to 5, I believe. And then I do have information from our disability benefit specialist, and that's the position that works with people who are 18 to 59 before they get to the elder specialist age. And that's the one out of Price. So Price County has that right now. Our disability benefit specialist also left the ADRC of the North, the Price County branch recently. So right now, Sawyer County doesn't have anybody but an EBS in training. But she was brilliant. She went on to go work back for her old company in insurance or something. And she did numbers for the last quarter. She worked on 51 cases, 14 of those were in Sawyer County. The monetary impact for Sawyer this quarter was $21,041 back to our people, basically, money that they saved in some way. And then the annual monetary impact for her this year so far in Sawyer was $107,455. So, I mean, just with the disability benefits, and those are the ones that have the numbers with when we're talking about money. None of the other divisions of the ADRC or APS, other than the financial abuse, gathers money numbers. But just with that alone, you can tell how much of an impact we have in the community with helping people secure their finances. In addition, I know that you guys asked for a little bit more information about what was presented in March with the purple state and such. So I was just going to see what information you might need and if it's something I can gather from the state, because this was all gathered from a state presentation that they did for the Aging and Disability Independent Living Network. And basically it just kind of showed, you know, what's happening with ages 60 and older. This is 2020. So, you know, you can see we're still, you know, orangish, getting into the red there. And then we turn here and we are one of the top, because this is 40% to 54% of our projected population for age 60 and older is going to be our county. And then when we get to 2040, you can see that all of the aging population starts to move north. Everybody wants to retire here. It's a great place to live. It's a great place to retire. Why wouldn't you? And that's what they see people doing, is moving out of those city areas and up to our neck of the woods. And by 4050, we're pretty much, there's a couple of red spots in the rest of the state, but really it's all up where we are. So I just kind of wanted to give a heads up back then about kind of what the state is seeing for the aging population coming up here. And then in addition to that, our dementia care specialists also had some facts on Alzheimer's, which kind of plays into that a little bit. And then on the back side of that is 2025 Wisconsin Alzheimer's statistics. And I have those in a little packet for you guys. And then, I'm sorry.
We'll add that. I'll get it electronically and be able to upload it.
Yeah, thank you. And then how many of you guys have been down to Rice Lake or Superior? Has anybody seen the ADRC signs on the side of the road, the billboards as you drive by? The state did a huge push because they decided to do a statewide resource directory for the ADRC and do a 1-800 number, which is all a great idea. And eventually it's going to work. However, what happened was the state decided that they were going to take all of our information from our websites, put it all in a resource directory, and it was going to be perfect. Well, they found out that it wasn't. And basically every county is now, the state handed it back to every county saying, you are now tasked with fixing what we did. And so basically, we do have a great resource directory, so you can just type in WIDHS for Wisconsin DHS and then the ADRC, and you're going to come up with the resources and all about the ADRC. But if you plug in anything like housing, you're going to find that there's some pretty wacky stuff going on in there. And so right now, our dementia specialist, our part-time dementia specialist, who's also our regional phone person half-time, is now tasked with fixing what the state did. But the 1-800 number works. We're getting referrals from the 1-800 number and such. So eventually, I think it's going to be a really good resource for people, but just not quite yet. So, and I think that's all I've got. Thanks, guys.
Thank you.
Let's move on to behavioral health.
Okay, Alicia has her report in. I don't think there's been any major things, Alicia, changes that we want to highlight. I already highlighted that it's really difficult to hire a mental health therapist. Otherwise, the programs I think are going pretty steady. Like, I don't think anything major has changed.
We have a lot of changes, but
But of the services, yeah. Of the services, because the internal workings probably is.
sort of.
So main thing is we're trying to streamline a lot of things in those programs. But the services and what we're putting out there is about the same. Any questions on that? Otherwise, we'll keep moving through. Okay, so then, where am I at? Mobile Crisis and Community Support Program. I think I have Caitlin on the line. I don't know. Caitlin, is there anything that you want to highlight on your report or anything outstanding that you want to?
I don't think so. I think in May we saw a few more assessments than we did the previous month, but crisis is kind of staying steady. And then CSP, it's pretty rare when we have clients discharge, but we did have 2 clients discharge and then brought on two new ones, so they were replaced right away. Their spots were. We only have 15 of the 47 folks living in placement outside of, independent living. And only 14 of those folks court orders now, and that number continues to go down, which in my opinion is a good thing. Yeah, nothing else to really report.
Okay, thank you. Then we have our mental health expense report and our typical report on our second page. One thing that we're gonna just need to be watching is we have had, I think we've had somebody in Winnebago pretty consistently for the last 3 months. So it's been, we release one, we think we're good, and then another one needs to go. So we've been having, and that's where it's making me want to really look at those bed days to kind of see where we're at in comparison to previous years, so we can better project those expenses. And then I don't really have anything on this last report, except for one of these patients that is in here is going to have some Winnebago costs.
When are the reduction in the costs going to take effect?
Those aren't going to be, that's not Winnebago.
Oh,
Those costs were in juvenile placements. So basically, the ones that are like in Lincoln Hills who are so naughty, it's kind of like putting them in jail, but we're putting it's for juveniles. So those, it's, we pay for our county here, our county jail here, but our county jails don't take youth. And then they all basically go to one area in the state. It was supposed to be able to contain costs. And really, in a lot of the things that we've done, we've reduced so much of the kids going to jail. I'm kind of getting back off of that, onto that again. But that really, we don't have enough kids there to like make up for it. So there's less and less going. So each individual costs more and more and more because you still need the staffing there. So that's where those expenses come. But yeah, Winnebago is not going down. Winnebago, the only potential thing that could happen related to Winnebago is the state did file for a waiver because I can't remember what IMD stands for, but it has more than 16 beds. And once you're in a behavioral health unit with more than 16 beds, medical assistance no longer covers, and that becomes a county cost. If we can get the waiver and allow that type of behavioral health unit to be covered by medical assistance, that will reduce our county costs. So where that stands now, given everything that's happening federally, I don't know if they're approving those waivers or not. So, but it was promising that our state kind of moved through that because the counties do take the brunt of it compared to other states where those are like a state program. So. Okay, mental health, behavioral health area. I think we've gone through that. Oh, I'm sorry. Caitlin, thank you.
I just wanted to share that we have a newer hospital down in the Madison area, which is a long ways away, I realize, but I've used them a lot through our hospital contract where we do voluntary assessments, and they have accepted more challenging clients that I had assumed would probably be a Winnebago type placement. And so that is promising.
Yep. So what happens is We didn't talk about this either, Caitlin. Caitlin has to actually look for other placements before she can place them in Winnebago. Winnebago is kind of the last straw of where you place. And so we look around, and then what happens is sometimes they are too difficult for anybody else to take, and then Winnebago takes them. So it is promising, and her team does a really good job looking for alternative placements. Okay. Moving on.
Child, Youth, and Family Services.
Okay, so we have the CPS and out-of-home care report. A few more access reports have been received, but nothing really out of the norm. So we're kind of status quo on those pieces. And the same as we move into the youth justice report. We did actually have 2 referrals in May. Giving us a total of 7 for the year. Which when, I'll have to do a comparison. Compared to last year, we're bringing in a lot less kids into the program. And right now, actually, Sarah is writing up court reports to get ready, because now, like Carol, she's filling in as a supervisor. She's filling in for Shannon, who left YJ and went over to work with Carol. So, and then we have our foster care, or our children in care reports. One of the things that we did see is an increase in foster care payments that will be happening, but that ends up being a pass-through. So it's not something that's going to impact us, but that did happen in the state budget. And, and then that is it on that report. Next month, we'll talk a little bit more about our back to school plans and truancy, and how we're going to work with the schools as we move forward.
Let's move on to economic support.
We have the report from Shauna in here. She's not able to be on the call today. I do not know of anything major on this, except for, and I don't know if I reported this out, but for our wheat program, we had more expenses this year than anticipated, but we were able to get a grant from, or the state had additional funds. So the $20,000 we would have had to figure out how we were going to be short on or not have services for. We received the funding to be able to stay status quo. So that was nice. Okay.
Public health.
Julie has stayed for public health.
I have one question.
Oh, I'm sorry.
The grant that you just talked about, the $20,000, how is that obtained?
It's not really, we get funding through by actually running the WEAP program here. And so there was extra funding with the state, and they noticed that we were taking in we were asking for money faster than we normally would have. And they noticed that, and they reached out to us and asked if we could use some more money. I'm not going to say no. So yes, that's how we got that one. Julie.
I just have a couple updates from my written report. One, I did pull communicable disease numbers yesterday, and we are still seeing quite an increase in anaplasmosis, Lyme disease in our jurisdiction. In our region, we're also seeing Powassan virus, and I know that the state put out information on Powassan.
You want to say a bit about that, though? What Powassan is?
It's a tick-borne illness. We've actually had 3 hospitalizations of the 3 cases, and 1 passed away. So it can give severe neurologic symptoms. So we haven't had any cases here in Sawyer County, but it has been in our region. So we're just alert and have alerted our healthcare partners to that. So wanted to let you know. Also, As a part of our Muskie Fest outreach efforts, we had our Medical Reserve Corps and our staff member Joyce give public education on emergency preparedness, personal emergency preparedness. And she reached over 2,700 people at Muskie Fest, and that actually was picked up by the news and actually on a national listserv for MRC units this week. So that was kind of exciting. I did want to include our annual report for the Western Wisconsin Public Health Readiness Consortium. We are a part of that, and that gives us a lot of support in our emergency preparedness efforts and a lot of collaboration, planning. It really augments our efforts and really amplifies our efforts. So wanted to highlight that, and that is all. Any questions?
How do you spell that tick-borne disease?
Oh, I am not a good speller, but, and I don't have it
I
in
can
front of me.
Google it for you,
P-O-W-A-S-S-A-N, I believe, but Julia can,
P-O-W-A-S-S-A-N. Is that what you said?
that was almost like a spelling bee. Yeah.
That's not the red meat one, is it? The one
Is that the what?
the tick disease that makes you kind of allergic to red meat?
Oh, no, that's alpha-gal.
Oh, thank you.
Yeah.
There's too many.
Thank you.
Okay.
All right, so.
We had, like you asked about adding that PFAS
right.
to there. I'm not as, I pulled up the what's happening, so we can kind of go through that. We're looking at an order for Natural Resources Board to amend certain rules, so chapters 280, 281. And what they're looking at, and basically this is mainly more for your awareness. So, and we can go ahead and there is a public comment period open, so we'll put that in the notes for this so that people can click on it and go on to the public comment period. But what's happening is at a federal level, the maximum contaminant level for PFAS has been established. And so the EPA will start holding people accountable. So to be federally, it will be a federally supported level that needs to be maintained. What this is looking at is actually taking that federal law and moving it into state law, kind of like we do on a number of other things where even we make state law and we bring it into our county ordinances and saying that we're going to be upholding them. Basically, that's what this is. So the impacts of certain PFAS to Wisconsin surface water and groundwater are threats to public health, welfare, and safety. Establishing water standards for PFAS contaminants in this rule will protect the public health by setting the MCL that may not exceed in certain public water systems. And the other piece says that this proposed rule will revise the existing rules in place to be consistent with the new federal standards. In addition, by adding to the state rule, Wisconsin will retain primary enforcement authority over the state's public water systems. If Wisconsin does not promulgate these rules, Wisconsin will lose its primacy over water systems in Wisconsin, and EPA would enforce SDWA, and PFAS standards directly for all of Wisconsin's water systems. So it's happening right now is it's just an open comment period, and then wanting to understand if there are any financial implications for counties or for anybody which there's what they're seeing. Financially, from what they've shown so far, they didn't think that there would be any increased cost by making this a state rule, because no matter what, federally, whoever is contaminating these areas is going to be responsible for cleanup anyways. So
Weren't they looking for a statement for county support of the new,
They're looking for
280?
comments, either positive or negatively on promulgating this rule.
so would that come from the county board then?
Potentially, and actually, it's not necessarily even county can write a resolution or make a comment. People individually can make comments on it as well.
And I think it's by the end of the month.
It's July 23rd that we would want to make a comment on that.
So do we want the county board to do a resolution to support the new PFAS standard?
Don't look at me. I'm not your voting member, so I can't say one way or the other. And or do you want to make public comment? Do you want any public comment to happen? And or we just push it out for people to know about it and read about
Do
it?
you want to say, like?
Yeah, we could do that.
On the main page so that the public.
Could see it.
comment.
Yep, we could do
Yeah,
that.
documents.
There's a link to it that I can get for you.
I think it's important, and it's becoming more and more, people are becoming more and more aware.
We have been doing, well, I shouldn't say we, the DNR has been doing spot testing around the state. Julie, you're probably still getting. Yep, you're getting some of those because I used to get them on the back end. So they'll, as a courtesy, they'll let the health officer know about it. We haven't had any that has popped in Sawyer County positive on any of the well testing that they've done so far. So that's been positive.
Okay,
Fiscal is
do we need to
next.
talk any more about the budget?
No, I don't think so, but if you guys have more things you want to talk about, it keeps us not that exciting, but it's a lot to think about.
So purchases, service and revenue recap?
Yeah, I kind of went through, really when I went through everything that we were at, there isn't anything except for I want to keep an eye on, again, those out-of-home placements. That's really where our big expenses come as a county.
Does anything jump out at you?
Well, I did run through June and we had a little rougher month in June for the youth justice. We spent about 20% of the budget in June, so that did put us a little ahead. Overall, it's not too bad for purchase services, but the youth justice is now almost to 3/4 for the year through June.
Yeah, you got us jumped up another month ahead of this.
Because the kids are out of school and getting into trouble?
We've had a few that have popped back into needing a higher level of care. So, but we have one that's just actually been discharged and waived into adult, so. Not another area.
All right, are there any board appointed committee updates? From anybody? Correspondence, reports and from conferences and meetings? Does anyone have future agenda items that they'd like to?
Nope, just next month we'll do the final budget. That's just part of our plan, so.
And there will be another public hearing then?
We'll just
for
open
that?
it up for any comments they can open up, but I'm not doing any reporting during that public hearing. It's just their opportunity to be able to.
So there will be a public hearing?
We'll just open in there. Yep, we should have a public hearing just on because what will happen is we'll have all the numbers in the plan out there. They can come and make comments on it. So it might be 5 minutes. It might be none.
Okay.
Depends. And if there's anything that comes as a written report, I'll bring that with me. Because they are open to be able to email our general number to give it information.
Okay, anything else? We're adjourned.
Thank you.
Okay, thank you.
Thank you.